I am not a historian, but neither are you. So, how about we the people learn this stuff together? Welcome to US 101.
Healthcare. The thing that many of my friends, and at one time myself, did not have. It's also the thing that your parents have, and maybe because of that you're entitled to it, and the thing that millions of Americans continue to debate. And once again, healthcare is on the forefront of America's mind now that the House of Representatives recently voted to repeal and replace the Affordable Care Act, also known as Obamacare, with the American Health Care Act. And I'm happy to report that once the House voted to pass the American Health Care Act, they accepted the vote with the grace and dignity that we have come to expect from our federal government. Now, the AHCA is not official yet, as the bill has to go through the Senate before it can be enacted, but this vote through the House of Representatives already has advocates of Obamacare freaking out. Now, I'm not saying that the Affordable Care Act was a perfect system. Far from it, okay? Insurance premiums were high, and there was a tax levied against people who didn't sign up for healthcare insurance. But opponents of the AHCA have also pointed out its flaws, saying that anyone that has a pre-existing condition could be denied coverage, $800 billion are going to be slashed from Medicaid, and the wealthiest Americans will receive a tax cut because of this bill. And amidst this rigmarole that is the healthcare debate, many people ask time and again, why doesn't America, the strongest and largest nation on the planet, have a universal healthcare system like the one that they have in Canada or in England or in Australia, which usually results in conservatives grabbing their torches and pitchforks and angrily yelling, "Stop talking, Bernie Sanders!" But what I want to focus on for today's episode is, when did the topic of healthcare even become a discussion in the United States? When did some Americans first decide that going to a hospital, seeing a doctor, receiving prescribed medicine should be a right and not a privilege? For that, we have to head back to 1854 and meet the activist Dorothea Dix. Dix was one of the first to present a healthcare proposal to the government. She wanted the government to raise asylums for the indigent insane, as well as the blind, the deaf, and the poor. She came really close. The bill actually passed both houses of Congress, but was ultimately vetoed by President Franklin Pierce, who claimed that social welfare was a state responsibility, not a federal one. And then later, in 1865, at the end of the Civil War, the government established what became known as the Freedmen's Bureau, which raised hospitals and employed doctors to treat sick and dying former slaves in the South. And from 1865 to 1870, the Freedmen's Bureau treated over 1 million former slaves. But unfortunately, by 1870, hospitals in the South had to start closing due to rising violence from a small group of cowards you may have heard of, known as the Ku Klux Klan. And it would be another 70 years until the topic of healthcare became a major talking point in the government. In 1933, following the Great Depression, millions of Americans couldn't afford medical care. So President Franklin D. Roosevelt attempted to create publicly funded healthcare programs, but was vehemently opposed by groups like the American Medical Association, who claimed that programs like this would be considered compulsory. And due to staunch opposition, Roosevelt unfortunately had to drop these programs from his New Deal. And then later in the 1940s, Roosevelt's successor, Harry Truman, tried to pass a universal health care bill, but was again opposed by the American Medical Association, who is now using a term that to this day still strikes fear into the heart of many Americans: socialized medicine. And by invoking socialism, the AMA started stirring up fears that America was going to leave behind its capitalist roots and start going the way of a communist regime, which we damn well would not do because we sure as heck ain't no Russians. We're America, goddammit. In fact, the excuse of socialized medicine was also the reason that Lyndon B. Johnson couldn't pass a universal health care bill in the 1960s. But despite opposition from the AMA and some conservative Republicans, Johnson did manage to pass what became known as Medicare in 1965. And for those of you that don't know what Medicare is, Medicare provides healthcare coverage to anyone that's over the age of 65, as well as to the blind, deaf, and disabled. Throughout the 70s, there were multiple attempts to try to get a universal healthcare bill passed, and one of the leading advocates of universal health care was Senator Ted Kennedy. Kennedy proposed what was known as the Health Security Act, which was a single-payer system that would provide coverage to almost every single American. But unfortunately, the bill never made it out of Congress. And then we jump to the 1990s when Bill and Hillary Clinton attempted a major healthcare reform by introducing the American Health Security Act in 1993. The plan proposed healthcare for all Americans via private insurers in a regulated market. Furthermore, employers would be required to provide healthcare to their employees, pay 80% of the premiums, and healthcare plans were required to provide a minimum level of benefits. But in 1994, following disputes between supporters of the bill and its opponents, who claimed that the AHSA gave more power to the insurers and took away the rights of the patient to choose their own doctor, the bill was killed. And then, most recently, we have the Patient Protection and Affordable Care Act, which was signed into law by President Obama in March of 2010. Democrats praised the plan, saying that with the passing of the Affordable Care Act, more Americans than ever would finally get healthcare insurance. Meanwhile, Republicans didn't like the plan so much because, again, the claim of socialized medicine and then something about death panels and a whole lot more. Oh, and it also didn't help that Republican turtle senator Mitch McConnell told many Republicans not to go along with Obama's plan because, quote, it tended to convey to the public that this is okay. They must have figured it out, end quote. Are you kidding me? So now that you've gotten your history lesson, let me turn it over to you guys, man. Do you think that healthcare should be a right for all Americans? Should Americans be guaranteed healthcare across the board, and should the government provide it? Or are you someone that prefers having the type of healthcare that lets you decide what kind of healthcare you get by being able to select your insurance provider? I know that this can be a deep and divisive topic among people, so can we please keep the discourse in the comment section below civil, guys, please? And that is it for this episode of US 101, guys. If you want to read more about this topic, I've included some links down below in the description box. And thanks to all of you that have subscribed to the channel, that are sharing the videos, that are liking the videos, that are commenting on them. I sincerely appreciate your guys' support of the channel. And if you're brand new to the channel, welcome. We talk about history here. Hopefully you hang out. As always, guys, you can follow us on the Facebook, on Twitter, on Instagram, all those links down below in the description box. And I want to send a special shout out to my subscriber, Beth, for supplying today's intro. Thank you so much, Beth. It was an awesome job, and you were the first one to do it. Well done to you. You have set the precedent. If you guys want to submit your own intros so that you'll be able to kick off future episodes of US 101, you can email me your videos. You can email them to ushistory1882@gmail.com, or you can send them to me through Twitter at USAHistory101. And on that note, guys, thank you so much for watching. I will see you next week for another episode of US 101. Until then, we are all done. Now, before I go, you're looking a little pale. Do me a favor, just turn your head and cough. Do it again. Do it again. Don't know why doctors ever did that. Just prove that I could cough. I can cough. I can cough just fine.